of the things that pregnant women really don't like having done during their pregnancies? That would be vaginal exams, also known as cervical checks. The good news is, during pregnancy, there's only a few times where a vaginal exam is recommended, such as if your provider thinks that you might be in preterm labor, if you are getting scheduled to have your labor induced, and of course, if you are in labor. I know that for a number of years, women would have their cervix checked routinely, especially at the end of pregnancy. However, if you are not showing any signs or symptoms of labor, honestly, it's not necessary, and you always have the right to decline an exam. If you have a history of any kind of sexual trauma, that is something I highly recommend you talk about with your provider before you undergo an exam. Otherwise, you will be miserable. So if you are going to have your cervix checked, here's what I recommend. First of all, empty your bladder. Otherwise, it's going to be pretty uncomfortable. When you come into the room, they're going to have you take your panties off. That part's actually really important. They'll cover you up with a drape. You're going to lay back on the bed and either put your legs in a frog leg position, or you're going to put your feet in stirrups. You're going to scoot your booty to the end of the bed. Your provider's going to put a glove on. You're either going to put some gel on the end of the glove, or they're going to run their fingers under warm water. They're going to gently insert their fingers into your vagina, and they're going to feel for your cervix. The first thing they're feeling for is the position of the cervix. Most of the time, your cervix is in the posterior or the very back part of your vagina. So if it feels like they're digging pretty deep, they are. The next thing they're doing is feeling for the consistency or how soft your cervix is. A cervix that's not ready to labor is going to be as hard as your nose. A cervix that is ripe or favorable is going to be as soft as the inside of your cheek. The next thing they're feeling for is how thinned out or effaced your cervix is. A normal cervix is 4 centimeters thick. If this is your first baby, you will thin out and then dilate. If this is not your first baby, you will dilate even though your cervix is still thick. That number is described as a percentage. So you'll hear them say, she's 50%. That means that your cervix now feels like it's 2 centimeters thick. The next thing they're going to feel for is how dilated or open your cervix is. Here's my little dilation board. At the beginning, you're going to be 1 centimeter, which is about as big as the tip of your finger. As your labor progresses, your cervix will get further and further dilated. Once you are 10 centimeters, you will be considered complete, and that is done. Once your cervix is 10 centimeters dilated, that is also called complete, and you are done dilating. The last thing they're looking for is what's called the station, where the baby's head is in relation to your ischial spines, the narrowest part of your pelvis. Once your baby's head is at the level of these ischial spines, you are at a 0 station. If the baby is not quite there yet, you have a minus number. Once it's past the ischial spines, you have a plus number. Now here's the thing with cervical exams. They are what's called subjective. When we feel in there, we can't see, we can't measure, and so we are going by feel. So if you have an exam and your provider says that you are 3 centimeters, and the next person comes along and says you are 2 centimeters, you did not get smaller. It's just their opinion of how your cervix feels. Now, when you have a cervical exam, again, it can be very, very uncomfortable. You may have some cramping afterwards. You may also see some bleeding for the next couple of days, and that is perfectly normal. So, what questions do you have about having your cervix examined? I hope you'll drop those in the comment section below. And while you're in the comment section, I sure would appreciate it if you'd hit the like button.